Good morning, everyone. Thank you for joining us as we hold the second Department of Corrections Town Hall since the start of this pandemic. We know that staff has a lot of different concerns, so we wanted to bring everybody together so that the director, deputy directors, as well as our division chiefs, assistant division chiefs can help answer some questions and address some concerns. So without further ado, I'll go ahead and get started. We do have a PowerPoint presentation, and I'd like to welcome Director Labbe up to the front.
Good morning. I'd like to welcome everyone to the Department of Corrections Town Hall. I would like to thank you for taking the time to join me for this important discussion, both those who joined me in person this morning as well as everyone watching the video recap. I have been leading the department for more than a year, so I thought it pertinent, especially in these times, to address employees' concerns. Although I've been with the department for more than 30 years, this time as director has taught me many new things about the agency and put me in a position where I can generate positive change and hopefully make employees' work days much smoother. While I know change does not come overnight or even over in a year in some cases, it's discouraging to know that many employees are frustrated, burnt out, and even at wit's end due to the department's response to the COVID-19 pandemic. I want you to know that I hear your concerns, sympathize with you as I have two sons who are also correctional employees, and I am working around the clock to address these concerns and ensure that this agency continues to be a place where people can work a fulfilling career and enjoy a well-deserved, relaxing, stress-free, vacation-filled retirement. I don't know if you can tell I'm looking forward to this too one day. During this town hall, we will discuss several topics to include staffing, overtime, budgetary constraints, and of course, COVID-19 and its impact on our operations. I am hopeful that the town hall and PowerPoint presentation will inform you and allow you to get an understanding about the department, show you what is being done on the back end to provide relief to employees to reduce the number of people getting burnt out from work, and hopefully allow you to make suggestions to improve our efficiency. The philosopher Aristotle once said that patience is bitter, but its fruit is sweet. While I think we can all agree that patience is bitter and it appears to be a barren tree, I just ask for your stick-to-itiveness at this time, that you don't give up on the department so you can enjoy the fruit once we make it through these hardships, that you realize your labor isn't in vain. I am joined this morning by the executive management team to include my deputies, as well as our managers and our division chiefs and assistant division chiefs, all of whom will introduce themselves and speak to you throughout the town hall. Various questions have also been pre-submitted and will be addressed towards the end of the town hall. If you have any additional questions after the town hall, please submit them through the Ask the Administrator box outside the operations office or by emailing them to askdoc@co.pg.md.us. Without further ado, we're going to start with our PowerPoint presentation, and hopefully I'm able and technique savvy to be able to operate this. Some of the topics that we are going to talk about, as I said, we're going to discuss COVID-19. We're going to talk about our retention. We're going to talk about our operating budget because I believe people should understand where our agency is as far as how its operations are when it comes to their budgetary allocations. We're going to talk about our overtime, which I know many of you are concerned with. We'll talk about the Bureau of Administration and what they are doing as far as inmate services and how we are providing services to our inmates in light of COVID-19 and the pandemic, teleworking, as well as respect and communication, and then also our employee support service unit. And speaking of COVID-19, we had a total of 192 cases among our inmates since the start of the pandemic. And when you think about our average daily population being over 800 plus, that's very good, considering some jails and prisons have had much higher numbers. A total of 424 inmates have been vaccinated at the department thus far. We're concerned about the Delta variant, and we'll talk a little bit more about that. We are following CDC recommendations. I know some people are wondering why we can't be a little lenient and lax on our responsibilities as far as inmate movement or lenient as far as masks and all, but we are following the CDC guidelines and what the science is telling us to do today. And you must remember, we are a congregated living environment. We have individuals in our custodial care, and their health is paramount to us. The inmate health is very paramount to us, and it's not them that is in danger. We endanger them because we go out in the community every day, and we could bring the virus into these confines. And also mandatory testing. The Delta variant, as you know, cases are going up, variant cases are going up daily. And as you can see, we all are now going back into the mass. At the beginning of the summer, as we know, when the vaccines were rolled out in January, the promotion in this country was to get everyone fully vaccinated so that the country could reach herd immunity. If we had gotten to a 75% to 80% herd immunity in this nation, we would not be wearing masks today. However, we did not get that, and the Delta variant now has reached the shores of America. If you know anything about the Delta variant and you've been following the media regarding COVID-19 and the pandemic and the viruses, you would know that when it hit the country of India, it hit it like a wildfire. Okay, this variant is very fast as far as fast spreading. It's much easier to catch. It's contagious. It's faster, and also the illness behind it and the effect of the illness behind it is devastating. People say, well, why should I get vaccinated? You should get vaccinated because what vaccination does is it keeps you out of the hospital, and it also keeps you and protects you from death. And so that's the purpose of why that we're encouraging the vaccine. And I know when people said, well, I'm fully vaccinated, why can't I take off my mask? The reason why you can't take off your mask if you're fully vaccinated is because you are now a danger and could endanger those who are unvaccinated, particularly with this Delta variant going on. So that is why they're asking everyone to mask up. It's not that, oh, well, are you saying I'm going to get sick again? You possibly could catch it. The vaccine did not say, and the vaccine is not, oh, you'll never catch the disease. What the vaccine does, it protects you from the virus causing you to be hospitalized, as well as the possibility of the death from this virus. This virus is very serious. I could actually attest and say and give a testimony that I acquired COVID-19. And the thing about the virus is that it's unknown. No one could say cough due to cold and everyone is going to have the same similar symptoms. You don't know how the virus is going to affect you. Some people come from it and they're asymptomatic. They could get up, they never know they have the virus. They don't even know that they're a spreader. They don't even know that when they cough into the air and you walk into it, that you now have acquired it. You do not know how it's going to affect you. But what I could tell you from my experience is this, is that no day was the same when I became ill. One day I felt well, but the next day I felt like a Mack truck had hit me, and I couldn't even lift up my head. I ran fever, I ran chills or whatever, and it literally I felt that I was going to die. I exposed my husband so much so that I didn't even realize it, and we didn't realize it until he became hospitalized, and he ended up being hospitalized longer than me. But he also had a heart attack that he had no idea about that he was having as a result of this virus. So this virus is very serious, and I cannot recommend and stress to everyone that if you haven't gotten vaccinated, to consider getting vaccinated so that we can become herd immunity in this country and go back to being normal. The scary thing, though, about the Delta variant is this, that the vaccine, when it first came out, was really targeted for those of us who are older. I'm not going to say elderly or senior, even though I may look like that. I am a diva, and these are wisdom vines. Not gray hair, they're wisdom vines, okay? So as a result of it, it rolled out for those of the more senior population in this country and those who might have been immunocompromised. So most of us have gotten vaccinated, but the vaccine was not made for the younger population yet. And as a result of it now, the Delta variant is hitting our younger population. That's our future. Our future is dying among us. So we need to really seriously consider, are we doing ourselves justice when we say, no, I don't trust that, it's experimental? Well, I'll tell you this, when you go to the doctors and he writes a prescription, he or she writes you a prescription, you really don't know the side effects of that medicine. But yet you run to CVS, Walgreens, or Walmart, you fill it, you take it, and you wait to see what happens. We've had the measles vaccine, we've had the chickenpox vaccine, we've had what they call now MMR, which is measles, mumps, and rubella. And we've had them for generations. And vaccines have helped us. And so I cannot stress enough the importance of really seriously considering this, because we are putting our younger generation at risk. And these cases are going up continually. All I could tell you is to educate yourself on the science of the virus. Don't listen to conspiracy theories. Don't listen to, well, I heard. Do your reading and your education for yourself. Get your understanding for yourself so that you can make a wise decision of whether you should get vaccinated or not. Don't say, oh, I'm going to wait and see what happens to you. I became fully vaccinated because I acquired the virus, and I'm going to be honest with you, I would not want to live through that ever again. And so I stress, and I have stressed to all of my family the importance. And trust me, I had naysayers in my family who didn't want to get vaccinated. But once I got sick and they realized the effects of it, they decided that maybe it's best that they should do the same thing. So I can't stress enough to educate you. But what I can say, and I want to say kudos to this department, is that we have done a good job as an institution when it comes to thwarting and controlling COVID-19 in Prince George's County Department of Corrections. You should give yourselves a round of applause. I have to say today that, and I can report this today, sometimes I don't want to report it because we do not have an inmate in here that is positive from COVID-19. And that's all because of you, the staff. You being concerned that when you go out every day in the community, you are conscientious about following the CDC guidelines as far as wearing masks, washing hands, keeping your distance, making sure that your area is sanitized. So we have done a good job of controlling it, not just in the fact of the guidelines that CDC told us how we should do in a congregated living environment, but you had to do a good job because you go out into the community every day. And you come in here every day. So you made a very good conscientious effort to watch how you socialized and follow the guidelines while you were out in the community so that it would not come in here. And I have to say thank you for that. I thank you so much for that, because we have done a yeoman's job when it comes to COVID-19 in this department. And I can't thank you enough. I'm going to stress again, and you're probably going to keep hearing it. We did a pop-up vaccination clinic trying to get people vaccinated. We are probably going to try to do that again. We're going to increase the testing because that's what's coming out, rolling out, is that testing has to be increased and all. Yes, there's a booster that's coming about, as you can hear on the news, and people are going to say, Oh, well, when is it going to stop? It's not going to stop until we get herd immunity. And that is a reality. It is not going to stop. Will I take the booster? Yes, I will. Do I recommend anyone who has been fully vaccinated to take the booster? Yes, I do. I'll be the first to test and have a sign saying you need to get vaccinated. So I can't stress that enough, because this virus mutates, and as long as there's an unvaccinated host, which means one of us, it can mutate to another level. And so I want everyone to consider that. When you're thinking about, oh, I shouldn't do this, oh, I don't believe this, study the science. Study the science. We had to change this town hall because of the new Delta variant. My original plan, and I apologize, the staff, was to have this town hall meeting in the ODR where we could have more employees be involved and actually watch it live. However, from our medical director's advisement, she really did not recommend this type of setting where we together are congregating at all. Her recommendation now is that we go back to virtual for everything. So it is changing again. It is going back to where we were a year ago. But I'm thankful that she said, okay, if you do it in a smaller environment and keep your distance and keep your mask on, you could continue. And I just said, this is what we're going to do, because I would like to have somewhat a live audience. But this virus is very serious, and I cannot stress it enough. Many people have lost their lives. We lost over 500,000 of people in this country alone. And that's not to say what the numbers are now with the Delta variant. That was with the original pandemic when it first hit our borders. That's a lot of lives that possibly could have been saved. So we are going to continue our mandatory testing for those that are unvaccinated, because that's what CDC recommends. And I just want to prepare everyone that if you're watching the news and if you're watching the trends of communities, vaccination probably will be mandated for employees. The Maryland Health Secretary has already stated and recommended that he's recommending a requirement that employees require their staff to be vaccinated. So I think the train is already on the track, that we'll start seeing jurisdictions mandated, and we'll start seeing counties and cities mandate that vaccination will be mandated, and you will have to take it. So we're on that train, and I want to move on. I don't want to keep beating a horse about COVID-19. What I'd like to do, though, before we go to the next topic, is at least have the deputies introduce themselves, and we'll go from there.
Good morning, everyone. My name is Gregory Smith. I'm the Acting Deputy Director for the Bureau of Operations. The areas that fall under my command are the Support Services Division, the Security Operations Division, and the Human Resources Division.
Good morning. I'm Guy Merritt. I'm the Acting Deputy Director for the Bureau of Administration, and underneath that bureau we have the Inmate Services Division, we have Population Management, and Community Corrections.
Since the majority of division chiefs and assistant division chiefs are here, and for the video audience, I'd like them to come up and introduce themselves, starting with Mr. Frazier.
Good morning. My name is Bill Frazier, Human Resources Division Chief, and we're responsible for DET, or training, and personnel and payroll, Chronos, and compliance, and other such things. So happy to be here today.
Good morning, everyone. My name is Alicia Creighton. I'm the Acting Assistant Division Chief of Human Resources.
Good morning, everyone. How's everybody doing? Pretty good. All right. I am the acting chief of the Inmate Services Division, and under me falls the Behavioral Health and Wellness and also Educational and Vocational Services.
Good morning, everyone. I am Tanya Thompson Creek, and I am the Acting Assistant Division Chief for Inmate Services.
Good morning, everyone. My name is Latasha Humphreys, and I'm the Chief of Security for here at the Department of Corrections, and I'm responsible for the overall operations to include special operations.
Good morning, everyone. My name is Acting Major Sharon Gilmore, Assistant Division Chief of Security.
Good morning, everyone. I'm Jesse Shelton. I'm the Assistant Division Chief for Support Services.
Good morning. I'm Major Luke Dixon. I am the Division Chief for the Office of Professional Responsibility and Legal Affairs, which includes internal investigations, special investigations, some people call it the Gang Intelligence Unit, along with our Legal Affairs and ADA section.
Good morning, everyone. My name is Kevin Easton, Acting Assistant Division Chief for Community Corrections, and also standing on behalf of our Acting Division Chief, Elizabeth Coconut.
Good morning. My name is Jeffrey Logan, and I'm the Chief of Population Management, and there are several sections underneath that. So without further ado, I will not expound on that. Everyone knows that I talk a long time, but suffice it to say, population management is responsible for several facets of what we do here, and we undergird what goes on at this department. Thank you.
I'm going to ask the president of PGCOA, Prince George's Correctional Association, to introduce herself, please.
Good morning, everyone. I am Master Lieutenant Tammy Owens, PGCOA President. Thank you.
I thank everyone that is on the executive management team for joining in person with the town hall meeting. We're going to go to the next slide, and what we're going to talk about, which I think would be very interesting, Deputy Director Smith is going to talk about it, but it's about retention and our vacancies. So I'll turn it over to him.
All right, I believe everyone in the room and also everyone that's watching virtually understands the challenges we've been facing as it relates to retention and hiring of individuals in the correction profession, both uniform and non-uniform. As of today, we have currently 396 sworn employees, 128 non-sworn employees. As far as vacancies, we have 75 employees who have retired or either resigned during the pandemic, which gives us 90 sworn vacancies as of today. We also have 38 non-sworn vacancies. What we've been doing in an effort to attract new candidates, we've had our recruiter, Corporal Harad, and I want to give him a shout out for the hard work he's been doing, being innovative and thinking of things outside of the box. Traditionally, as far as advertising and putting the word out about what we do here at the Department of Corrections. One of the things, several of the things he's done, and to broaden the horizon to give people the word that we're hiring is, you may have seen some billboards on 301 as you travel up and down the highway. We've put out mailers to the community, targeting certain zip codes. We've also put up signs in not only this jurisdiction, but also neighboring jurisdictions in an attempt to attract individuals to the profession. During this year, we've also had one institutional support class. We graduated 12 non-sworn employees. And we had one correctional officer class with 7 sworn employees. We also attended 29 virtual recruitment events, which, as you know, can be a challenge, as traditionally we have been face-to-face and done things face-to-face prior to the pandemic. But we've had to think again outside the box in order to attract individuals to the profession. So we are going to continue doing virtual events, as well as, based on the direction we're given from the county exec's office, try to attend more in-person events, barring any restrictions that are put in place. Thank you.
The next slide is about budgeting. Anyone who knows me, okay, we want to talk about a little bit about our annual budget comparison. If you'll look down at the bottom of the chart, the blue bar, graph bar represent what is our actual budget that we have received as a department, and we're comparing that to our overtime. In FY 19, fiscal year 19, which really started out July 1 of 2018 through June 30th of 2019, our budget was 89, and I'm just going to round it up, 89.5 or 89.6 million dollars, and our overtime that we spent was a little over $8 million. In FY 20, which kind of is the pandemic year, sort of, but the pandemic had not started, because this fiscal year started July 1 of 2019 to June 30th of 20. We got a small increase of 96 million in our budget, and we spent 8.8 of that 96 million in overtime. And then FY 21, and this budget that year just closed June 30th of this year, which was July 1 of 20 to June 30th of 2021. We were granted 94.8 million, and our budget increased, as you can see, and that's due to our retention, that's due to our vacancies. A lot of individuals have retired during COVID. Some people have decided to move on. COVID had definitely impacted our manpower strength. And as you can see, we've spent a little over $10 million for that. If you look down at the bottom of the chart, our vacancy totals, we had a total in FY 19 of 81. It decreased by only 77 in FY 20, but we're already up to 128, just about double that in FY 2021. Which one do I hit? Oh, okay. I thought, okay, I don't need to do that then. Thank you very much. Talking about our budget, I want people to see a comparison of where our money actually goes and what we spend. In 2020, as we said, we got we got $96 million, but if you look at the comparison, most of our money is in compensation. And compensation basically means staffing, your manpower. It's not in operating. So $55 million, more than $55 million is actually going to compensation in 2021, the fiscal year that just ended, 53.8 million was in compensation. 90-something% of our budget is in compensation staffing. That's not in operating. Operating is what gives you your resources, the things that allow you to do your job. And so when staff complains and say, why can't I get this chair, or why isn't there enough money for the chair, look at the comparison. Okay, our costs are being expended on staffing. And every year that staff wants or negotiates an increase on salary, our compensation is going to go up, which may also mean that our operating will be reduced because the county may only have so much money that they can allocate to us, and so they're trying to balance the budget and make sure that they give us the minimum needs that we need, but also if the money's not there, it's not there. And the county's economic recovery was slowly coming around at the beginning of fiscal year 19, at the latter part of 19 into 20. However, when the pandemic hit, it affected our revenues greatly. So as we thought we were getting out of the woods, where we could breathe a little bit and open up our belt a little bit, where spending could occur, because our revenues, we were seeing some revenues increase. The pandemic has affected the county's revenues all the way around. So in 2022, our operating has went down, and that's because of our vacancies and all, 52.3, and our compensation is 52.3, and our operating went down 14.1. One of the things I want you to realize too when it comes to budget is that sometimes because compensation is there, we can't say, like you could say at home with your own budget, well, take it from that account. Budgeting doesn't work like that. Okay, if it's allocated for a specific thing, we have to operate it and use it for that specific thing. We can't just say, okay, well, there's some extra pool of money here. We're going to take it from here to use it for here. We cannot do that. That's not good budgeting, and that's not good management of budgeting. So most of our money is spent on staffing and fringe benefits. And so I want staff to understand that most of our money is spent on staffing. And then when you look at overtime, because overtime is also included in those staffing costs. And that's something that we have to consider. And so one of the things the county did, because we were having such a slow economic recovery, is that the county had decided we could not hire. They did a hiring freeze. Now, the hiring freeze did not affect the sworn personnel. Where the hiring freeze affected was the non-sworn personnel. So there are areas that we need to cover, because every day we get mandates that may be coming from the county council, it may be coming from the state. Your legislatures are still working, and they still make laws, and they still are trying to improve our lives. And so sometimes these mandates, or laws as I call them, but these laws that become mandates to our agencies are unfunded. And what I mean by that is that there's no additional money when this law is made put into our budget. However, we have a requirement that we have to meet. So for example, there was a law that came out in 2017 that said, in this jurisdiction, that said every agency in the county will have to do a language asset services. And in the mandate, it said you have to have one full-time person dedicated to that. However, that full-time person, they didn't put money for that full-time person in that law, but yet we're mandated to get a full-time person for that. And then the challenge was that we were on a hiring freeze. So the position was not there. However, we were mandated to make a position and create a position. So when people ask, well, why do we have non-sworn and why do we have sworn and non-sworn positions? It's because our sworn positions are the ones that have been we have been, since 2008. I've been doing the budget with the department since before that, 2001, when I first went to support services. But since 2008, when we could actually create and develop our budget, since 2008, the positions that have been approved and authorized in our budget for hiring have been sworn. It has not been non-sworn. So yet we still have things that we have to run. For example, we still have to meet the state's mandates when it comes to the Maryland Commission on Correctional Standards. That's what keeps us open. If we don't pass and meet the compliance of those audits every 3 years, they would shut us down. So we do need auditors, and we need staff to have auditors. And that's what makes sometimes these TDY assignments. So I want staff to understand that people are not just moving people out because we want to. We're not playing a game of tiddlywinks. This is a game of necessity. This is a game of making sure that our department runs efficiently. And I think sometimes what happens is that folks don't understand budgeting. And so it was very critical for me to make sure that you see the picture of budgeting and understand how budget works. And sometimes when you see numbers and when you see the dollar sign, you know how it is when you go to the grocery store and you thought the bag of rice was going to be 99 cents, but now it's $1.09. Or how many of you have been in the line and you thought you totaled up the price one thing, and then you open up your wallet and realize you're $5 short, or you have seen someone, maybe y'all are luxury, so you never had to do this. But I've had to do this. You could take back, especially if it was like a Snickers bar for my sons. They don't need this Snickers. But in the meantime, they're in the grocery cart yelling, "I want my Snickers!" So when you don't have enough money, there's nothing you could do about it. But the best thing that we do here, and we do a good job, I have to say, to support services, is that we manage our budget well. And in fact, this department, when the county changed from going to what they call zero-based budgeting to performance management budgeting, we were one of the first agencies to get an award for how we do our budget. So we do a good job on managing our budget, and we do run this agency as efficiently as we can. So I'm not beating up on you, but I want you to get an understanding of the numbers, because sometimes when you have the numbers, it paints a different picture. You could change, Andrew. So I just want to talk about overtime, or maybe I'll let Deputy Director Smith have this one.
Put me on the hot seat.
Yeah.
All right, as it relates to overtime, we've, trying to think outside the box, considering all the restraints that we have and the circumstances we're dealing with. Some of the things we've tried to do is we've done a duty day initiative, which has brought individuals who were assigned to support functions outside the security division. They are handling tasks that are administrative roles, if you will. And so we have those. They used to have traditionally Saturdays and Sundays off, but we tried to come up with a way where we could incorporate them and to assist the staff on the weekends who are struggling and getting held back to back or having to do overtime every other day. So I said, well, let's have those individuals come to work, and we'll just have them work one day out of the weekend and split their days off, either Friday, Saturday, or Sunday, Monday. It was an unpopular decision for the most part. However, we had to think about what's best for the overall agency. Was it inconvenience to some folks? Absolutely. Is this something that we want to continue forever? Probably not. However, but in the meantime, we have to operate in the way that we're doing it. Also, we're going to continue. We want to create a focus group. And when we speak of that, it's not just about the overtime. It's also creating a focus group as far as scheduling. Because scheduling is a concern, and we have to look at it at least to see, are there any other options that can help relieve the pain for the staff that are on the front line. Right now, we have approximately 68 officers who were identified as being part of that duty day initiative that take part in the working on the weekends that are in TDY or temporary duty positions. For those that don't know, I'm colorblind, so I'm looking at this this chart. So just bear with me.
Red, green, and yellow.
Okay, I'm just
The
so.
blue is the voluntary, the orange is the mandatory, and the green is the duty day.
So I'm just going to do the numbers, okay? All right. So 279 individuals did voluntary overtime in the month of June. We had 188 that were held on mandatory, and we had 42 individuals who typically would not have worked on the weekend. They did duty days in the month of June. So in July, we had 274 individuals who did voluntary overtime. We had an increase that went up to 216 for mandatory, and duty day numbers decreased down to 33. And some may say, well, why is there a change in numbers? Well, for those that have been in this profession for a while probably understand that, the summertime is our peak time for vacations. So those individuals who were assigned outside of security, they did not have the opportunity to put in for leave. So we tried to work with them as best as we could to say, while allowing them, they have the responsibility to be at work, also trying to give them a day off during the week or weekend with their family. However, while not trying to have a huge impact on the operation. So that, which explained why the number went from 42 to 33 in July. That number has kind of stabilized off, like we're hovering between 38 and 40 as traditionally the number for the way August is looking. That's how we'll look for the month of August. Next slide, Drew. So, I'm going to ask Deputy Director Merritt to come up and talk about the Bureau Administration.
Those two are hard acts to follow, but I'm going to try. I'm mainly a listener and not a talker. But I want to tell you a little bit, and I'm going to speak personally about this past year. I was actually number 2 in the department in terms of people that were identified as having COVID. I never seem to make number 1 on anything. I had it way back in, I think it was the end of March. And I had a mild version, thankfully. My whole family had it. My mom had a rougher time, as older people do. When this whole thing started, and we started to shut things down, we started moving people out that we felt like we could live without for a minute. So people from inmate services went out the door. People from the Community Corrections Center went out the door. We closed the center down. When we closed the center down, when the director at that time, Mary Lou McDonough, said, we need to shut down, we need to push people out. For those people who have toured CRC, it's a small location. It would be impossible not to have a spread of anything that goes on. I think during the 14 months we were open, we had a couple of people who had the flu, and it seemed to go from one person to the next pretty quickly. So we had to move people out. But when we did, I actually started our reopening plan because I thought, okay, we'll be reopened in May. But May came and went, and things just got worse. We made it through that peak that we had in the summertime, and things leveled off. And we thought, well, maybe we'll be open in the fall. And we actually had plans. We did workshops right prior to bringing people back in, thinking we're going to get open in October, November. It didn't happen. The virus kept pushing these little waves along. The uneasiness of all that, not knowing what's going to happen from week to week or month to month, takes its toll. Takes its toll on the people that are here, people that have to be here because their job requires them to be here. Takes its toll on people who we've pushed out. We've had a lot of people in telework who felt like, when do I get back to seeing the people that I'm supposed to be working with? And I think that all of us up here understand that uneasiness and the frustration, and we feel it too. Chief Logan started to go on about his division. I just want to briefly outline what he does oversee. He handles the pretrial investigation unit. He handles all the classification, the records, and the release team. That's a heavy undertaking. It means they have to take a look at everybody that's brought into the building, figure out whether or not they are appropriate for release. If they're not released, where do we place them? Or do we place them in a medium security, in max security? Is this somebody that we're going to move right on down to H5 because we know in the past they've caused trouble before? A few issues that have been going on, and I have to give kudos to Chief Logan, is that he has been extremely short with staff. short of staff, not short with staff. If anything, he's been extremely supportive of the staff. And the director has been working diligently to figure out how can we fill those positions. How can we get the positions that we're able to fill now filled? How can we work to the next fiscal year and get all of those positions filled? The other thing that's occurred over this past year, there was a big push by the court to move people who had lesser offenses out the door. And Jeff worked really hard with the courts to figure out who could we move out, who should we roll the dice on and move out. And in retrospect, that's been extremely, it's been successful. People that we might not have taken out in prior years have done well. And what we're finding is that we can take people out who have more serious charges. On the flip side, what does that mean for the people that remain in the building? It means that we have more people with more complex and more serious charges. And that plays a part in how we have to deal with people who are left here. Inmate services, when the pandemic hit, everything shut down because inmate services is a face-to-face business. You know, if it's not an individual, it's a group. And that means a spread. And I think at that point we didn't know what that meant to have a group of 8 or 10 inmates in a room with a facilitator. And we're still at that point. We're slowly reopening, but we've had to figure out different ways of dealing with things. Inmate Services handles education, vocations, the C Corp program, which has transformed from our 90-day substance abuse program to an SBIRT unit. SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. And that's being done hand in hand with Dr. Meske and her medication-assisted treatment program. They also handle religious services, and they also oversee the partnering agencies, the jail-based program, and the prevention unit that comes in from the health department to talk about sexually transmitted diseases. The issues that they've had have been, how do you interact with people? How do you interact with the inmates while maintaining a social distance? All areas of that division have figured a way out. Through packets, through small groups. We hope that tablets will be coming towards the end of the year. And when that does, a whole new era of how we interact with the inmates will be entered. A big problem that we've had has been having no chaplain for 6 months. There were some issues that came along regarding the transfer of the contract for religious services. There was a hiccup with the first applicant that came through who had been identified. But we do finally now have Chaplain Keith Lynch, and he started, I think, 2 weeks ago. So we're on the right path with that. Community Corrections handles the community service program, the CRC. At this point, it now includes community supervision and urinalysis lab. That area was moved from population management to community corrections because essentially it is a community-based type of activity. It's a tall order to move that, and Chief Logan has been working with Acting Chief Kokernam to make sure that all of her staff are aware of how to do things effectively, expeditiously. That transfer occurred in July, and the work is in progress, and they're doing a good job. The issues that we have is CRC remains closed. We're asked by the courts, we're asked by the caseworkers in the health department and in the state's attorney's office, when are you guys going to reopen? The staff are asking, when can we come back? The reality is we don't know because we're taking our lead from both the CDC and the state. And as soon as we know more about when we can reopen those doors, we'll let everyone know. We did come up with a plan last May, as I said. I was expecting to be open in 6 weeks. We came up with a plan that allowed for a reduced number of people in the building, a way to figure out what happens if we do get a positive in the building, how do we handle making sure that the spread didn't occur. And when we reopen, I'm sure that we'll put those protocols in place. The community service program was shut down also. The community service program is that alternative sanction for people who have lower level crimes who can do community service as their part of their sanction. We closed down, but the courts were pushing for us to reopen. And last summer, with the approval of the director, we opened on a limited basis, and we are still going on a limited basis. The drug lab, the urinalysis lab, reopened in June, and we have new protocol in place to make sure that both the staff and the people that are entering for urinalysis are safe. And that concludes my piece of it. Oh, flip me to the next slide. Yeah, I forgot all about it. I was on a roll. One thing I didn't mention, the average daily population is just over 800 right now. If you guys remember, back last summer, Jeff had gotten the numbers down to about 5.25. And what happened there is all of those low-level offenders that we would have had in previous years were pushed out the door. Is that a good thing? It probably is. One thing the research shows is that low-level offenders probably don't need that much in the way of treatment. They don't need that much in the way of additional help. And getting them out to the street certainly didn't mean that they're back here any sooner. We're not seeing those people coming back. But what it does mean, as I mentioned earlier, is that we are left with the more serious individuals. Approximately 400 people are in alternative programs, so that's electronic monitoring, pretrial supervision, all of those activities, all those areas where we can have people on the street. I mentioned about the CRC, and I did talk about that push from the courts to get people out the door. And I think I have covered it. Yeah. So, thank you.
Thank you. As Guy said, we did want to do the reopening, and of course, this pandemic is fluctuating. It seems like as soon as we thought we could relax some things, we have to close some things. So we're continuing to follow CDC guidelines. And he mentioned about me as director working on our vacancies. I want you to know that I have been in conversations with our Office of Management and Budget. They had froze our non-sworn positions and said we would not be able to hire them until March of 2022. But in my conversations recently, they have renegotiated, and we are going to be allowed to hire some of our non-sworn positions as of today as we speak. So I am going to continue to advocate on our behalf. That's one of my jobs and roles that I see myself as doing, and so I will continue to do that, and we will continue to keep you updated so that we can have efficient operations. Teleworking. I wanted to talk about telework because we are basically an essential agency. But one of the things that the county had recognized, and a lot of jurisdictions are recognizing, is that it is favorable to offer to employees, if you can, an alternative work schedule. And that alternative work schedule could be teleworking. It could also be called what they call a compressed schedule, where some people work 10-hour days, 4 days a week, and have Friday, Saturday, Sunday off. It could also be what they call a flex schedule, where you come in 1 day, come in 2 days, or whatever. So the Office of Human Resources Management rolled out what is called the alternative work schedule, and telework is one of those components that was rolled out. And to us public safety agency heads, one of the directives was, even though we were essential, we should try to look at our agency and see if there are areas where we could allow some employees to telework. One of the issues with where teleworking or on an alternative work schedule works out is they have found out is, one, the pandemic kind of forced, as Guy said, getting people out. The less people you have, the less contagion. Whether people want to believe it or not, but that's true. So that was one of the reasons. And as we went through this training as appointing authorities, they asked us to look at our teleworking and see where we could do it. So as director, I felt that some of our non-sworn positions would possibly benefit from doing teleworking. And so the agreement is that you have to understand that teleworking started again, according to the county, effective August 2nd. But I want to back up and say one of the advantages across this country why they're finding alternative work schedules to work is that it is also saving money. You have less office space that you have to worry about, utilities and costs. So people, it's not just because we want you to be home, it's because it also has its budgetary advantages as well. So effective August 2nd, the county had decided that appointing authorities should look at their agencies and see where they could allow alternative work schedules. And I, as director, said that the only way that where I could allow it would be with our non-sworn staff, and I would consider that. Keep in mind now we're in what is called stage 2 for county employees. I'm talking about the entire county. Is supposed to be slowly but surely trickling back to work. As of August 30th, the entire county would be open. What that means is that it's going to be open to the public. Right now, public services, the public cannot come into county buildings and receive services. But as of August 30th, unless it changes due to this variant, we're going to be in what is called stage 3, and the county is going to be open up as in previous years prior, as in pre-pandemic days. So I just want to let people know that I allow non-staff to be approved for at least 2 days of teleworking. And they needed to be at least a minimum of 3 days on site. But what I want to know is, let everyone know, is that it's guided by our needs. It's a privilege, not a right. And also, I have the ultimate decision to determine and the discretion of when teleworking or any alternative work schedule would end. So because it was a lot of confusion and people didn't understand it, I decided as director that I will let staff continue to work from August 2nd, telework from August 2nd to August 30th. As of August 30th, when the county reopens up, I will reevaluate whether we will continue on an alternative work schedule, because I also want to see what's going on with the virus. What I don't want to do is bring staff all the way back in to have to push them all the way back out. And the reason why I said I will reevaluate it then is because the Labor Day holiday will be coming up soon. And they're expecting a higher wave after. If you notice, it seems like we level off with this virus. And then the holiday comes. We have a good time. And then after the holiday, the numbers rise up. So I am going to watch it, engage it, but I want all non-sworn employees who are participating, I want you to understand that it is a privilege, not a right, and it's my discretion to end it at any time that I did fit, okay? One of the biggest things that I have heard in the past year since I've been director is the subject of communication. And not just the fact that people don't say hello or how are you, because I know some people culturally don't find that saying hello bothers them. And that never offended me either if someone doesn't speak to me. But for some people, that is looked at as impolite. And I was raised that it was impolite. I was also raised that whenever I walk in a room, I'm supposed to say hello. So when you see me saying hello, that's because that's how my mama raised me. It's just second nature for me. But anyway, one of the things that I've heard a lot of complaints about is communication. But the communication that I heard which was very disturbing for me, was that the management staff and how they communicate to subordinate staff, the disrespect. And we are all adults, and everyone has a right to be respected, okay? We may not be the same in our job duties, but we are equal as adult human beings. And so as director, I expect respect. And I also am going to let you know as director that I plan to hold folks accountable for those who are alleged or accused of being disrespectful to their subordinates. There is no reason to create an oppressive environment in an already stressful environment. There's no reason for that. And there's no reason that you cannot get employees to cooperate if you know how to properly manage and talk to folks. So I ask you to think about how you speak to someone and how you would like to be talked to. Now, one of the things I want to say this is I heard that there was a lot of complaints from management, but I also want subordinate staff who are listening to this video today and who are here in person to understand you need to also offer respect back. And sometimes your body language and your response to your manager is disrespectful, and your manager is just trying to get a job done. And I understand we all may have bad days. I wake up some days on the wrong side of the bed. No, that's not true. My husband would never allow me to take his side. And I know we have those days, but if you know anything about yourself, or if you did a self-analysis about yourself, if you need to woosah, then you inhale and exhale before you talk to someone. But I do want to make it clear to all employees, respect goes both ways. And just like I will hold the manager accountable, I will hold you accountable as well as a subordinate. So don't walk around here with the ego, anyone, thinking that, oh, well, you know, the director said she'll hold my superior, my manager accountable, so I could just disrespect him. No, no, no. I will not tolerate disrespect from anyone. I want it to be known that the culture of disrespect will not be allowed in Prince George's County Department of Corrections. And I'm serious about that. And sometimes when it's personal, we'll take what others may call disrespect because you know the person. So you'll joke around and laugh like I joke around with my deputies. And probably if I joked around like I joke around with them to someone else, you would say, oh my gosh, that's appalling. But that's because of our relationship. And a lot has to do with the relationship. But overall, we must remember we should be polite, we should be kind, and we should be professional. I expect nothing less than that. So I just want to say these 3 quotes for you. One of the sincerest forms of respect is actually listen to what another one has to say. Sometimes people find it disrespectful when you act as if you're dismissive and they don't feel that they're being heard. Just take a few moments to listen to one another. And most of us today, we're living in a world that I have to say, and I don't mean to preach or whatever, but we're living in a self-serving world. We're living in a world that's instant gratification. I want it my way. And so when I can't get it my way, then somebody's disrespecting me, particularly if they're trying to give you a directive because this is what the policy says or this is what the rule says. Sometimes when your manager is giving you a directive, it's because that's what's required, that's what will keep you safe. And you must also realize we work in what is called the litigious environment, meaning that litigation could breed out of anywhere. And don't think that just because the department gets sued, you can't get sued. Do not think that. It involves you personally as well. So you should carry yourself as a professional because just like it may sue the Department of Corrections and the director, you could also, as an employee, be named in a lawsuit. You could also possibly, if you're not handling your job well, face criminal charges. We had such a circumstance some years ago in one of our infamous cases, and I won't name it, where it involved an officer, and the officer ended up, it wasn't only that the department got sued, but the officer ended up facing criminal charges and also found guilty and serving time today. So this is a serious business we're in. This is not a business where, oh, I don't care, I won't lock that door, I'll just go on home. No, this business is serious. And we have to be considerate to one another. Don't think as an officer, sworn officer, I shouldn't tell that person about what's going on, who's coming on the next post or the next shift. That which you may tell them could save their life or could save an inmate's life. Do not take this job for granted. It's a well-rewarding career. Trust me, I've been here 33 years. If it wasn't, I wouldn't have been here. And it pays well. I know it does because I look at some of your cars. I wish I had vehicles like that. Fortunately, I can't afford, my dream car is something that I could put the top down. And the only model that I found that I could fit in was the Mustang. So, so I can't get actually my dream car, but if you see the director one day riding down the street, Dilly Drive, with the top down and her sunglasses on and the wind blowing through the little bit of hair she has, just wave to me. Anyway, I speak to everyone the same way, whether he is the garbage man or the president of the university. This was Albert Einstein, and that's basically the principle that we are all equal. We may not be the same in what we do, where we live, who we socialize with, but we're still all equal. And then leaders who win the respect of others are the ones who deliver more than they promise, not the ones who promise more than they could deliver. If you know you're not able to do it, don't say you can, because that's where disappointment comes in. Be honest. Basically, this statement is saying be honest. And I believe in being honest. I believe in letting people know facts. I believe in when you give people understanding, then they gain wisdom. They get information and knowledge, but when you give them understanding, they gain wisdom and know how to make the proper decisions. And I believe in that. Share the facts. If you know it's not true, tell someone. Share it. Say that is absolutely incorrect. Stop the rumor mill. And then last but not least, if you have some respect for people as they are, you could be more effective in helping them to become better than they are. We all should be striving to help each other to live a better life. Are you your brother's keeper? You should be. You might answer no, but I'm going to tell you, yes, you are. Because we are codependents of each other. And we've seen that in this country through this pandemic. When we've seen our first responders, who we didn't look at as first responders before, because we always thought first responders were only police or firefighters. But when we saw the healthcare profession pull together and become the new first responders, or the grocery store worker who was willing to come to work when we were in our house locked down and we had to go on scheduled days, but they were willing to risk their life to make sure that your family could be fed. So I want you to realize that we are codependent on each other. And so we should have the ability that for the future generations, I want to make this world better. I want this world better for my grandchild than when I had it. My parents wanted it better for me when I was younger, and it was better for me, and we still should all have that same philosophy. All I'm asking for is that you be kind, be polite. You don't have to like everybody, but that doesn't mean you cannot work with them professionally. With that said, there's a lot of stress that goes on, and we all handle stress differently. Some of us have hobbies, and we know how to deal with our stress. Some of us don't even recognize that we're stressed out at all. You know, some of us, our voice raises, escalates, or whatever. Some of us, we don't know. Some of us cry. I'm a person that I tell people, if you need to cry, cry. You know, it's healing. Go do what you have to do to relieve. Some of us have to exhale or whatever. I call it woosah. And so, you know, my deputies hear that all the time. Look, do I need to woosah? You know, and some of us may need woosah moments. And that's why we have the Employee Service Unit. And so with that, I'm going to turn it over to Anisha Prasad.
Good afternoon. Thank you, Director, for this opportunity to address all of you. We've spent a good deal of time this morning and now this afternoon talking about COVID and the effects that this pandemic has had. It's not just about the physical it has impacted significantly mental and emotional health. And so we need to be aware of that. And I want to underscore the need to be intentional about self-care. And as the director was just pointing out in terms of kindness and empathy, like we really are all in this together. One of the things that I've consistently said to people, when you look at what's been happening, whether it's the pandemic, whether it's the social, political unrest, my gosh, the things that are going on in Afghanistan and Haiti right now, that it feels like there's no real safe space, right? Like COVID and the way it shut everything down, it took away people's kind of sense of normalcy and groundedness. Things that you normally would do to take care of yourself, spending time with family, going places, traveling, all of that has been changed and compromised, and it does have an impact, and it impacts all of us. I mean, I believe that is why, as Deputy Director Mayer was saying, like our numbers have increased so significantly with serious charges. Like you see it everywhere. Like people just wilding out, like throwing stuff at a restaurant and yelling at people and this vitriol. I believe it's because it's the buildup, the isolation that people have experienced, the tremendous losses people have experienced, the anxiety that people are carrying. And so we need to be mindful of that. When the director talks about kindness, you don't know what that person in front of you is going through, whether it's your supervisor or you are the subordinate. You don't know. And so just for us to recognize that we are in this together, and me treating you with kindness and respect and empathy says, you know, I care about you, and we are in this together. Like, as professionals, it should be no holds barred. But again, understand that sometimes we are a little off balance. You know, not only are we dealing with the anxiety with COVID, the changes with COVID, still people with childcare issues, daycare, you know, things shutting down. But the overtime, right? People are freaking sleep deprived. And so it's harder sometimes when you're tired to respond appropriately. But like the director said, take a couple seconds before you speak out or say something. Like if you feel like you're not in a good space, take a moment to just be quiet for a second before you respond. Do some deep breathing. We're hopefully going to start up mindfulness classes again, but take control of the things that you can take control. There's so much that's outside of our control, but do the things that you can. Hopefully people are getting out and working off that extra 15 you put on from COVID. Physical activity really can help in terms of mental health and stress management. But I do want you to know that we are here and that we do care. And so you can reach out, and a lot of people have, but we are available if you need to talk. Myself, Captain Rawls, Tariq Walton, who is our part-time counselor. Our numbers are here. You can email us or text. Voicemail isn't that great. I'm not good at that. So please text or email so that I can get back to you. But also I want to remind you that EAP is available. We do have a new contractor as of January 1, Innova Services. Their number is available. It's 1-800-346-0110, or you can reach them online at innova.org/EAP. And again, that's confidential services. If you're not comfortable coming to talk to us, because we are here in the department, I respect that. Please know that those services are available. And please understand that they're wraparound services. It's not just about counseling. It's about anything that you have need of. Someone called me because they had a need for childcare, and they have those services: childcare, elder care, nutrition, finances, the free half hour of legal consultation. In terms of the child care and the elder care, they're kind of a concierge, as they refer to themselves. It's supposed to be like anything that would take up your time during the workday, where you've got to make all these calls, they will do for you. You just kind of give them the parameters. I have my children are these ages. I would like to find someone in this round. They'll get back to you with a list of potential providers. Same thing for elder care. So again, please recognize that those services are available for you, and that we are here for you. Please reach out. If you know that you're not doing well, it's okay to not be okay. Please just let someone know. Please feel free to reach out to your command staff, right? The captains, Lieutenant Colonel Humphreys, Major Gilmore are available also. Like if you need to just let them know what's going on, please feel free to do that. Thank you, and be safe and be well, everyone.
So before we wrap up, we did mention that we had a number of questions that were pre-submitted before the town hall. So we have our deputies, director, and some of our division chiefs and assistant division chiefs who will answer some of those questions. So I'll read the question and then call up the individual who's answering it. So the first question we have is, why are only unvaccinated staff being tested mandatory? There has been both vaccinated and unvaccinated infected with this virus. The unvaccinated has been now placed in position of exposing their medical status as well as being singled out. So I'd like to ask Deputy Director Merritt to come answer that question.
It's a good question, and you know, I'm going to just speak back to an incident that occurred in the spring, where actually it was right after the director had spoken to a larger group and said we didn't have any inmates with COVID at the time, and we came back to the jail, and sure enough, we had, I don't know, what was it, 5? I mean, suddenly we had like 5. We didn't know that because, or we wouldn't have known that if we hadn't been testing people in the worker unit. And I think that transfers to testing of our staff. We won't know if the virus is here unless we do test. Now, the whole idea of unvaccinated people versus vaccinated people being tested, I think back when that came into play, the thought was it was a bit of a perk to get people to get vaccinated. And at that time, we believed that people that were vaccinated were in the clear. One thing I can tell you right now is we're in talks about whether everyone needs to go back to mandatory testing because, again, we're learning things as we go along. I don't think it was to single anybody out. I don't think it was to try to make people feel one way or the other. And it's probably changing as we learn more about what's going on with this virus.
Thank you. The next question we have is, what is the current percentage of DOC staff, including contractors, who are totally vaccinated for COVID-19? And I believe Division Chief Mr. Frazier is going to answer that question.
Andrew, as of last week, we had 61% of the staff had been vaccinated. Okay.
Next question is, will those who have not been vaccinated be required to be COVID-19 tested on a weekly basis? And I believe, I asked Deputy Director Smith to answer that.
Well, to kind of piggyback on what Deputy Director Merritt was talking about, we're in ongoing conversations as recently as yesterday. It wasn't even 24 hours ago. We were discussing what are we going to do because of the we're in constant change when it comes to this pandemic. So I don't have a direct yes or no. I can tell you that it is possible. We are taking direction from not only from the director, but also from the county health officer, the CDC, the state. So as soon as information is provided or a decision has been made, we'll pass that information on to the workforce.
Next is, why are officers being told their Fridays don't mean anything anymore? We understand we have a grievance procedure for when we do get held, but shouldn't officers on a Friday be at the bottom of the mandatory pool? And Lieutenant Colonel Humphreys will address that question.
Okay, so to directly answer that question, that is correct. The officers on their Friday should very well be at the bottom of the mandatory list. But I just kind of want to give a little bit of insight of how mandatory should be, so we can be consistent amongst all 3 shifts. So if you're scheduled to work, you're at work, and it's not your Friday, you don't have leave, it's not your, you're just here the following day, then you'll be first as far as being held mandatory. So those people go first, and then it's back to back. Officers who may have worked yesterday but have to work again today. And that's, you can refer to your contract, Article 20, if you need some more insight. So after back-to-backs, then it's officers who have leave the following day, and then lastly are the officers on their Friday who will be held mandatory overtime, in that order.
Overtime is bad right now, so why are TDY officers not doing duty days or being held mandatory? And Deputy Director Smith will answer this.
All right, to answer that question, TDY officers that are assigned outside of security, they are doing mandatory overtime. They also are doing duty days. We do have a select group of individuals who in certain positions, due to the requirements and their responsibilities, they are unable to do some of the things, but it's a small number. We have individuals who are under the Bureau of Administration, for example, who may not work the weekend, but they plug in gaps to help out with duty days during the week. And they also are on the mandatory list. So to answer the question, everyone that's, except maybe one or two for some extenuating circumstances, everyone that is on the TDY post does mandatory overtime as well as a duty day.
No. Are COVID-19 vaccines available to detainees upon request? Please describe any ongoing DOC campaign that informs detainees how to request the vaccine. And Deputy Director Merritt will address this question.
So yes, they are available upon request. They can put in a request utilizing the request forms. They can talk to staff. And we're really pushing for the inmates to get vaccinated. For one reason, we're hoping that we can get more people vaccinated so that they can possibly be utilized in the worker unit. And for the other pieces, we just want to keep the spread down. There are flyers out that should be up in the units talking about the benefits, talking about any incentives that we have. The director approved a, is it $25? Yeah, $25. Yeah, $25 if you get yourself vaccinated in a commissary credit, and $60 if you then move into the worker unit at this point. So we're pushing heavily. I will tell you this, if you are out there in the housing units, support that type of talk. The inmates talk to you, they talk to each other. So be supportive and push those pieces of information out there.
So the next question is, officers that get held on a back-to-back are offered the least desired / busy posts due to VOTs and regular MOTs having already accepted a spot. Since officers that are on back-to-back are going to be the most tired on the roster, can they be given an opportunity to bump a regular MOT? And Lieutenant Colonel Humphreys will address this question.
Answer to the question directly is no. That's not how it works. We have a process in place that when you're held overtime, you get to choose where you want to work based on what's available. So in fairness to all, we wouldn't be able to move someone who's just on a, if you will, mandatory opposed to a back-to-back, although I understand you may be more tired. That's not how it works, and that would be a violation of the contract.
Next question, as RDO or RFM sergeants, why is it that we can get bumped into a housing unit? The memo that was sent out regarding sergeants in a unit clearly stated that in mandatory situations, a sergeant can be placed in a unit. Why are sergeants being put in the unit on their own shift? And Deputy Director Smith will address this question.
As relates to this question, traditionally, until recent time, and we are in uncharted territories, if you will, we never had a need to place correctional officer sergeants in housing units. That has not been the practice. However, due to the challenges that we're having with staffing, in an effort to also allow others to go home, sergeants will be placed in a housing unit. That is not something that we thought lightly when we made the decision to do so, but we have to do a lot of things that are not traditional during these times, and some of them will be uncomfortable and very unpopular. This is not something, it's nothing more than what you see. Is in an attempt to provide relief for those on the front line. And until we can get into a space where we're better off with relate to staffing, that's unfortunately how we're gonna have to do business. We will continue, as I stated earlier, to do more things and be more creative as to address the staffing issues. And as I've stated in the emails that I've sent out to the department, any suggestion that you have, we're willing to look into if it within reason and something that we can abide by, because we have other things that you may not consider, which is the collective bargaining agreement, which sometimes restricts some of the things that we can do. President Owens has been working with management in ways to try to give us ideas. We've been thinking of things that I don't think any of us have ever done in our careers. However, it's not any attempt to degrade a sergeant, if you will, or to put them in a situation where they're uncomfortable, but at the end of the day, we're all correctional officers. And then correctional officers, you're supposed to be able to work any post in the jail at any time. Thank you.
And last but not least, this question is, why do we have stop by? I'm a veteran of the department. When I started here, it wasn't such a thing. If we have 2 hours to call out from work, what's the purpose of this? It's not policy, so why? The roster should be done by the end of the day, and if not, who's accountable? And I'll ask that Major Gilmore answers this question.
The purpose of the stop by is to make sure that we have staff to adequately compensate the shift. So sometime at the last minute, we have additional posts or circumstances that we have to deal with. So it may be an officer called out sick, someone had an emergency. So to compensate you for that, we will pay you for your time for stopping by. We have had stop by since the Barry Stanton administration. Officers who complain that the lieutenants are not handling the roster correctly, that is being dealt with, but a lot of times it's not the lieutenant's fault that the roster is messed up. So to compensate everyone, you will be paid, command staff all held accountable, and we will do better with the roster.
I'd like to thank everyone for answering those questions that people had. And before we close, I'd like to turn it over to Director Labbe.
I want to thank everyone for participating in this town hall, those who are here with us live and also those who are watching and will be watching on the video cap. I think it's very informative, but I also want to let you know that I am trying to move this department to the 21st century as far as technology. There was a question about mistakes. I don't think it's intentional about why the rosters sometimes are not completed, but when you have a pencil paper type situation, that does happen. But we are going to be going to a program called Chronos Telestaff, which will automate our roster and scheduling system. And that should be probably starting in January of next year. We got grant funding to do that. And so we are looking at various processes. I want you to also know that this department was blessed with some grants through coronavirus grants that the federal government put out. And so we're trying to do some virtual cabling in the housing units in the multipurpose rooms so that we could also do virtual learning and have virtual groups where individuals could keep social distancing. We also are setting up cabling so that we could also do broadcasting when we need to send out important messages to the inmates. So you'll be seeing a lot of changes that are going on, and we're going to continue to make those efforts. And also, I want you to know that we are working behind the scenes to improve and make this department more efficient. Remember that you could bring it to your supervisor, use the Ask Administrator box or use the suggestion box. Stop using they. Don't be afraid to identify if you feel someone has victimized you. Say their name, put it in writing anonymously so that we know and we could address your issues and concerns. Again, I thank you for your participation. I ask you to continue to be DOC strong and Prince George's proud. God bless.